Good morning. Let's get this underway. Welcome to the John and Marlene Bowl Family YMCA. I have but one very brief piece of housekeeping. If anyone is interested in seeing more of this building, Chris Steinmack, John Harris, wave your hands after we're finished. Feel free to walk around and enjoy yourself and see what's happening, a little bit of what's happening in downtown Detroit. But I'm going to move this thing along very quickly. I have the honor of introducing a man, and many times when people say introducing my friend or my colleague, it's somebody standing at a podium just speaking things. But the way I know Mayor Duggan is he coached my son in youth soccer. So I knew the mayor long before he was the mayor, and long before certainly he was with the DMC. And I'm reminded of a beautiful quote by John Wooden, and it says, "The true test of a man's character is what he does when no one's watching." The mayor coached my son long before he was the mayor. Nobody was watching, and my son's all the better for it. Mayor Duggan.
All right. Well, what Scott didn't tell you is Scott was coaching the baseball team, and his son Matt picked the soccer team. So I've always said it was obviously my coaching, except that my son Ed went from my soccer team to the baseball team Scott was coaching, so we ended up even. But it's a long relationship, and Scott's commitment to fitness in the YMCA has been enormous. We're here today for a really special reason. The Affordable Care Act has been one of the great successes in America and successes in Michigan. We have 100,000 Detroiters who have health insurance today who did not have it 2 years ago. And from the years running the Detroit Medical Center, I can tell you, people who are living without health insurance live sicker, suffer more, and die earlier. Those are just the statistics. There's no reason under the Affordable Care Act for anybody to be without health insurance in this country today. So we have until January 31st. Well, we've gotten 100,000 Detroiters enrolled. We still have thousands who aren't enrolled. And so this week, with your water bills, I encourage people to open and pay the water bills, but with your water bills will be a reminder that by January 31st, there's an opportunity to sign up. It's been a great success, and you're going to get a chance to hear from a couple members of our community who went through the process of enrolling and the effect that it's had on their lives. But right now, I have a great privilege. My friend, the Transportation Secretary, Anthony Fox, 2 visits ago he came here with funding from a Tiger grant that made the M1 rail possible. So for those of you who are frustrated with the traffic jams down Woodward, the Secretary was the final contribution to that. The last visit, he came here with $25 million for the new buses. We've got 80 new buses on the street, and in the city of Detroit today, for the first time in 20 years, our bus system is running on schedule. It was enormous opportunities. The ridership is way up. And when I saw it today, I was with the Transportation Secretary to talk about health care enrollment. I said, he's pretty versatile. But it doesn't surprise me because he was a mayor, the former mayor of Charlotte. He's doing a great job. Please welcome Anthony Fox.
Thank you, Mayor. Thank you very much. Mayor Duggan, thank you so much for your great leadership, and it's great to be here with you and acknowledge all the hard work you've done and your administration has done to help notify folks of the upcoming enrollment deadlines. I love the unique way of presenting it on the water bill. That's amazing, so congratulations and great work there. I'd also like to recognize Congresswomen Lawrence and Dingell, who are here with us as well today, as well as Terry Campbell, who's joining us from Senator Stabenow's office, and also to thank Scott Landry and Chris Steinmack for hosting us here at the Bowles Family YMCA, a beautiful facility. I had a few moments here before to try to shoot some baskets, and a young man told me very clearly that I had no game left, so I'd have to change clothes to prove him wrong, but we'll see about that next time. Let me also thank Erin Knott and her team at Enroll America for all of the hard work they've done in getting folks signed up for coverage across Michigan, as well as our 2 community members here, who are really the ones who can tell the story much more effectively than any of us can. let me say how proud I am to be part of an administration that has tackled an issue that has bedeviled our federal government for the last 50 years. In shepherding through the Affordable Care Act, President Barack Obama extended health care to almost 18 million people who previously had no health insurance. And in the process, steadied the rate of the increase in medical costs and bent the curve on federal health-related spending as a result. Under the ACA, millions of folks have been able to gain coverage. The Department of Health and Human Services announced just last week that more than 11.3 million people are signed up for coverage through the health insurance marketplaces in all 50 states and the District of Columbia. That's a big deal. And with this progress, we've reached the lowest levels of uninsured folks on record. The ACA is also having a significant impact in this state. So far, over 325,000 folks across Michigan, and has been pointed out, over 165,000 of them from the Metro Detroit area have signed up for plans during this enrollment. But the progress we're seeing isn't just about getting coverage. Thanks to new protections like preventive services at no extra cost, everyone's insurance is better. And families across the country can now rest a little easier knowing that they can't be dropped just because they get sick or discriminated against if they have a pre-existing condition. It's also worth noting that coverage is more affordable than most people think. About 8 in 10 people who enroll in coverage through healthcare.gov qualify for financial assistance to make their monthly premiums more affordable. More people can find plans with premiums for less than $75 a month after credits. And getting covered now is easier than ever. Every year, healthcare.gov finds new ways to make signing up simpler. You can even apply on your tablet, and during the last open enrollment period, it took most folks about 10 minutes to submit an application. 10 minutes, low cost, it's a pretty good deal. So we're here today to ask folks to sign up before it's too late. You have until the end of January to sign up. But if you want coverage, that's if you want coverage that starts on February 1st, you need to enroll actually by midnight tonight. So let me repeat that. You have until the end of January to sign up in this period, but if you want coverage that starts on February 1st, you need to sign up by midnight tonight. And I want to once again thank all the folks at our Enroll Michigan, Enroll America location at HHS. It's really critical, not only in Michigan, but across the country. People who are helping folks get involved in the enrollment process. But let me also say this. Healthcare is essential in protecting folks from health and financial risks, but it's only one piece of the puzzle when it comes to an individual's health. Ensuring access to good health care and promoting health habits is a goal we share in this administration across departments. And I want to highlight a few things we're doing at the U.S. Department of Transportation to buttress the efforts to help Americans live healthier. As I mentioned before, the Affordable Care Act has been tremendously helpful in expanding coverage to millions of those who were previously uninsured. But many of these folks still lack reliable transportation options that they need to get access to medical coverage. The mayor's point about the bus investments we made here in Detroit is about jobs, it's about a lot of things, but it's also about people having reliable access to a good doctor. In fact, about 3.6 million Americans miss or delay appointments every year because they lack transportation to their doctor's office. Our Federal Transit Administration's Rides to Wellness initiative is working to improve this by expanding connectivity across the nation. With this initiative, FTA is building new relationships between health and transportation stakeholders by hosting events and regional meetings. And they're improving the coordination of federal resources by stimulating investment in local projects, most significantly awarding $400,000 in grants to 16 communities to design solutions to healthcare access challenges. Rides to Wellness initiatives are popping up in places all across the country, including in the nearby city of Flint, Michigan. A city coalition, including the MTA, a mental health service provider, and several others, has proposed a mobility management program that will include coordination between the healthcare system and transportation with personalized trip planning, travel training, enhanced service, and ITS improvements. This program is expected to reduce missed appointments, delays, and anxiety for a particularly vulnerable population. So we're working to provide technical and financial assistance to some of the most innovative and creative local projects and programs so that these access points can be enhanced. But we also wanted to produce and share more data to help local authorities make informed health and transportation decisions. And so to accomplish this, we worked with the Center for Disease Control to develop the Transportation and Health Tool. This tool is designed to help transportation decision makers understand how their transportation environment affects safety, active transportation, air quality, and connectivity to destinations. It also provides information and resources that can help public health professionals engage with their colleagues in the transportation sector to identify strategies to inform health supportive transportation plans, policies, and project decisions. What I'm basically saying is that historically, we've built transportation for transportation's sake. We're now encouraging communities, stakeholders, to engage in a outcome-based discussion about how we create connection points for people to use the transportation system for their health benefit. And at USDOT, we're continuing our efforts to preserve safe places for folks to exercise and commute in healthier ways. As a former mayor, I do understand that city leaders have a unique ability and indeed a responsibility to address things like pedestrian and bicycle safety. That's why we've launched the Mayor's Challenge for Safer People, Safer Streets. Under this initiative, our team has been working directly with city officials across America to improve resources available for transportation engineers, law enforcement, and others to tackle non-motorized safety. We've also given cities a clear roadmap for using those resources. So, for example, when you're on a street that has a bike lane, a sidewalk that's safe, a place for road users and pedestrians to cross those roadways, and new trail systems across the country, these are all parts of what we're trying to do to improve the built environment for all users, especially those who are using transportation assets for their personal health. This challenge has proven to be successful and popular, and in fact, we have 241 cities signed up, representing 46 states and 7 of the largest cities in the country. And we are thrilled that the Big D, Detroit, is one of those cities. And so I want to thank Mayor Duggan for being a leader in expanding pedestrian and cyclist safety. So we continue to make health a priority at both HHS and USDOT. And let me close by saying that whether it's extending health care to the uninsured or guaranteeing that folks have good, safe, reliable transportation access wherever they live, whatever zip code they live in, whether they're going to medical appointments or job interviews or institutions of education, this administration is working hard to give real folks a shot at achieving the American dream. The idea that no matter where you come from, you can make it if you put in the work and play by the rules. And we're going to continue to work tirelessly to expand this type of opportunity to people all across the country. It is our belief as an administration, and it is my belief as Secretary of Transportation, that there is no zip code in this country that should be off limits for good health care. There is no neighborhood where the access points should not exist. And we're going to do everything we can as an administration, not only to continue the great work of the Affordable Care Act, but to make sure real folks get access to it. Thank you very much. I think now we're going to turn it back over to Scott. Thank you.
Thank you very much. There are unintended consequences to the great things that our federal government does, and one of the incredibly positive consequences of all the work you do is access to this beautiful facility in the city of Detroit, and through the work you're doing is significantly enhanced, and we as a YMCA prosper. let me continue my theme of before they were famous. Before she was Congresswoman Lawrence, she was the hardest working mayor ever in the history of Southfield for 14 years. And before that, year upon year of service to the city of Southfield. And I'm not going to bore you with the details of that, but I just want to introduce the second hardest working Congresswoman.
We're teammates.
Thank you. It's an honor to be here today. It's so appropriate as we talk about the Affordable Health Care Act, Scott, that we're in a facility that promotes health. You know, we always think about the YMCA as a place we go to engage in games, and we talk about the children, but the effect of having a facility accessible that we can go in and energize our bodies and contribute to our health is extremely important. So to the leadership of the Y, I want to say thank you so much. I know how critical it is that we continue to promote healthy lifestyles by giving the community access to these, to the Y as one of those major contributors. I want to say that it is a critical period right now to get covered. It was so eloquently stated by the mayor how important it is for us to continue. I just wanted to share some numbers. Our Secretary of Transportation, who I knew before he was secretary, is an amazing mayor and leader in our country. But the Census Bureau 2014 American Community Survey estimates that nearly 9 million Michigan residents, more than 90%, were able to get health care in 2014. Now, at the end of the open period, February the 15th, 2015, 340,000 Michigan residents had selected a plan or were automatically re-enrolled into the marketplace coverage. 88% of Michigan consumers who signed up as of January 30th qualify for an average tax credit of $240 per month through the marketplace. It is important that we recognize that in our region, in Oakland County, and I serve Oakland County and Wayne County, in Oakland County in 2013, 9% were uninsured. That's compared to 7% of deduction in 2014. And in Wayne County, in 2013, there was 14% who were uninsured. And we're proud to say in 2014, only 11%. But we still have work to do. And so that's why I'm standing here with my colleagues, my Congresswoman Dingell, our mayor, and the secretary, and just amazing people who are working day to day to make sure that we get people covered. So while we're trending in the right direction, we have more work to do, and it's extremely important. I had a slogan as a mayor that a healthy city is a strong city. And this ACA is saying that America, if we are healthy, if we're not fighting the challenges of health conditions because we're getting early care, we're getting preventive care, we are on track to improve our health. The healthier we are as a country, the stronger we are. Health impacts so much of what we do. So I'm encouraging everyone to please know that you should get covered, that it is here, ACA is here for you, and as we continue to grow as a country and achieve the greatness of this America, we can do that with you in a healthy condition. Thank you so much.
Thank you. One other brief introduction. The chairman of the board of the YMCA and my boss, Jim Nicholson, who's also the president of PBS Chemical, has joined us today. So thanks for coming, Jim. Another big friend of the YMCA, Congresswoman Debbie Dingell, very instrumental in creating a beautiful public facility in Southgate, the Downriver Family YMCA, which is a beacon of wellness in that area. Would you like to say a couple words, Congresswoman Dingell? Thank you.
Thank you, my friend. I wasn't planning on saying anything, but when Secretary Fox invited me to an event supporting affordable care, the legacy I inherited from the man that introduced healthcare as the first bill for 59 years to get to affordable care was too important not to come and join them. And I'm honored to be here with Mayor Mike Duggan, who I have worked with on healthcare. We're not going to tell the stories or how old we are, but we're seasoned, not old. And my colleague Brenda Lawrence, to be in the city that she represents, it's an honor too. I have three messages. One, I believe if you're an American, you have a right to affordable quality health care, period. And that's what this bill did. The Affordable Care Act gave everybody that opportunity. And too many people still don't know they've got it. So that's why we're here today, to remind you. Two, you've got great representation. You've got a great mayor and a great congresswoman. So we're reminding Detroiters, because there's a challenge, everybody in Michigan has until the end of the month to sign up. So I'm hoping everybody listening will take an opportunity, and if you've got questions, there are navigators out there, there are people to help you. But three, anybody who knows me knows I am competitive. I cheer for the Detroit Lions, I cheer for the Detroit Tigers, I cheer for the Detroit Red Wings. I cheer for Detroit being the #1 city with the most people that enroll. We were 1 for a while, we've fallen to 3. Detroit, if we win having the most people enroll, the message it sends to the country, we're coming back and we've got the most people that care about affordable quality health care for everybody. So 2 weeks left, let's sign up and let's make sure Detroit wins that challenge. Thank you.
You get to follow that. And finally, the reason why we're here. Erin Knott is the director of Enroll America here in the state of Michigan, and she has a series of very important messages. So welcome over from Kalamazoo.
Thank you. It's a hard act to follow. I cut my teeth in this movement back in 2008 when I worked with former Congressman Dingell and Senator Stabenow on building support on the policy that ultimately became the ACA. Now I have the distinct honor of standing amongst all these champions of healthcare through the implementation process. Here in Michigan at Enroll America, we've recruited, trained, and mobilized over 5,400 volunteers across communities in Michigan to do this work. And my message is pretty simple. We have 2 weeks left. As the Congresswoman just referenced, Detroit was part of the White House's Communities Challenge. We've slipped to the 3rd spot. And while I love a good competition, what's most important about that competition is the fact that the consumers that we enroll from November 1st through the end of January 31st this year have the peace of mind that goes with quality, affordable coverage. We can't predict when we're going to have an accident. We can't predict when we're going to get sick. And in a moment, I'm going to turn it over to 2 individuals that can talk about their personal experiences. My final message that I want to talk about is in-person assistance. We know that 7 out of 10 people that seek in-person assistance have a better, successful opportunity in the enrollment. And as a coalition here in Detroit, we have dozens of events over the next 2 weeks, opportunities in people's own neighborhood to meet with in-person assisters, whether it's Access or St. John's or even the city's Department of Health and Wellness. In-person assistance is available. And you can go to our website at getcoveredamerica.org and find our scheduling tool to find walk-in appointments or appointments whereby you can schedule to sit down with somebody. There are no excuses this time. I'd like to now introduce Ms. Head and Mr. Sharp, 2 Detroiters that have unique circumstances where they kind of question, what's this Affordable Care Act? Is it too good to be true that I'm going to get financial assistance? I'm healthy, I'm doing all right. And for whatever reason, which they're going to share with you, they both took that leap of faith and enrolled in the Affordable Care Act, and they're here to talk about their experiences. Ms. Head?
Thank you. I didn't seek coverage until I was I used to work for the Detroit News and Free Press, and the department that I was in had dissolved. So from 2007 until 2008, 8 years, I did not have coverage. So I sought out coverage because I had a mammogram scare. So I went to see a specialist and qualified through a free program where the mammogram was free. Everything turned out fine. But then I got to thinking, well, after this, what if I get sick? Do I have the money to see a specialist? Which I didn't. So I sought out information through the Detroit marketplace. I was able to sit down with advisors who made sure I was secure in my decisions. They went over the different plans that I qualified for. And as stated, the marketplace is not fabrication. It does work. They do have programs for you. You basically sit down and talk with someone and let them know what you're looking for in coverage. and they will help find a program for you. And I am very, very happy with my decisions. I feel secure. I can go to the doctor. If I get sick, I can go see a specialist. It really works, and I urge everyone, if you do not have health insurance, it is very important to sign up tonight at 12 midnight. Tonight, sign up. It works. You need it. You need health coverage. There's no simpler way to put it. And I thank you for this opportunity and letting me share my story. Thank you.
Great job.
Hello. She said to breathe, so I'm breathing. My name is Damone Sharp. I signed up for the marketplace May 1st of 2014. I was urged to sign up through my mother. She told me you better sign up. So I signed up, and a little bit after I started signing up, I started getting some pain, stomach pains that I had. I didn't think it was a big deal. I said I'll just go to the clinic and see what it's all about. I figured they'd send me home and I'll be okay. I went to the clinic. They said you may have your appendix need to be taken out, so maybe you need to go to DMC. I end up going to DMC, and the doctor says, we're going to give you a laparoscopic surgery to see if it's your appendix. I said, really? You not just give me something so I can just go home? He said, no, we just want to make sure. So we had the surgery. He says, it's not your appendix. Appendix is fine, so we want to give you a colonoscopy. I said, what's that? And he told me what it was, simple procedure. We just want to check something out. So we did that. And he came back after I woke up and said, we found a mass. And we want to have surgery tomorrow to get rid of it. I said, oh, okay, no problem. I said, I got health care. I got coverage. I'm okay. I'm not worried about bills or anything like that. Do what you got to do. I wasn't worried because I signed up for the Affordable Health Care Act. So we went on and did that, had the surgery the next day. He took the mass out, came back a couple weeks later, and I had a doctor tell me that I had colon cancer stage 3. That was a big blow. My mother started crying. I was like, okay, what's the next step? He said 6 months of chemotherapy because we got the cancer out, but we just want to make sure and give you the chemotherapy. So that's what I did. I did the chemotherapy. I went through the 6 months of chemotherapy. I am now cancer-free. I can say that. Thank you. And I can say right now that I don't know how I would have did it if I didn't sign up for Affordable Health Care Act. It was a blessing for me to do that. I don't have to worry about the bills or how to pay them off, or the chemo treatments alone was over $200,000. So I know I could not pay that. The Affordable Health Care aided me in that and helping pay that. So I do urge you to sign up. It saved my life, and I believe it can save your life too. Thank you.
Thanks, everybody, for coming. Thank you for taking time out of your busy schedules. I'd be remiss if I didn't say one more time before we leave, if you're a resident of Detroit, look in your water bill. Otherwise, you've got 2 deadlines. One's tonight, one's the end of the month. Get health care, okay? Thank you guys very much.
It's easy to get affordable health insurance. For more information, call 1-800-318-2596. Anytime, 24/7. Or visit healthcare.gov. To find someone nearby to help you sign up, visit tinyurl.com/getcovereddetroit. Sign up today. Enrollment ends January 31st.